Hi there, have you just had some surgery or about to have some surgery on your hip, knee or shoulder or other similar areas, so joint, muscle, that sort of stuff? Then this is going to be a good video for you. We're going to go through what's going to happen after the operation and what you can expect. Hi, my name's Josh. I'm one of the physiotherapists from My Physio SA. This is sort of the stuff that we deal with a lot of the time here with our physiotherapists and exercise physiologists. We see lots of people after they've had surgery and help them with their rehabilitation, getting back to their full function and getting back to the things that they want to be able to do. So there's a few steps in that process. So obviously different surgeries require different rehabilitations and different exercises and different input and time frames to recovery. Now sometimes you should be a little bit aware about what's happening with that from your surgeon, and hopefully you've maybe even talked to a physiotherapist before you're going to have your surgery as well. After the surgery, normally you will feel a little bit sore, and depending on the surgery you might have a day or two or sometimes longer in hospital, and then you'll head most likely home where you'll have some exercises with you. Now it's really important in the hospital to try and clarify what you can and can't do from the surgeon or from the physiotherapist in the hospital, and really make that crystal clear for you what you're meant to be doing over the next couple of days or weeks until you then come in and see the physiotherapist again. What's also really helpful is if you can get some notes about what's happened in the surgery, so you can pass that on to us, to your physiotherapist when you go see them. Normally you'll catch up with your physiotherapist outside the hospital about 1 to 2 weeks after you've had the surgery. When you've been home, you've gone on, you're sort of feeling a little bit better, you settle down initially. And that's when we can normally then come in and start to help you progress with your rehabilitation. What we'll be doing at that point then is looking at how you're moving, what the surgery you've had is, what some of the protocols or the restrictions we have to watch out for. But most of the time we can start moving pretty well, and you can do most things initially with some guidance and some modification around there. And one of the important things is to try and get moving most of the time. And so we can give you guidance around that. We can help you with some exercises and progress them along a little bit and start to get you working a particular joint or the muscle that needs to start to improve. Now that process is going to be, it can be a long period, so it can take time. It can take up to 12 months or more depending on the operation, and we can help you through that process with exercises, with specific stuff to target that area, with some treatment around there as well to help you get things moving, to help you manage any discomfort that you're getting, and walk you through that process back to full function. And our aim at the end is to get you back to doing the things that you want to be able to do, and that might be walking or gardening or sport again, or whatever it is. That's going to be the aim, and that's what we'll be tailoring all the stuff specifically to what you need. So that's a bit of an overview of what the steps are through there. Along that way, you'll probably have some checkups with the orthopaedic surgeon, and often we'll communicate what's happening via letters back to the orthopaedic surgeon, so they know what's going on and what you're doing from a physio perspective, so everything's communicating well and we're all on the same page, and that's a really important part to that too. So it's a big process going through surgery. Most of the time people end up really at a really good stage down the track, but you do need some help and some reassurance and some guidance along the way, and that's what we can really help with. So we look forward, if you have any questions, and feel free to look at our website. We've got lots of information there on our blogs around different joint surgeries and orthopaedic surgeries, so get some information there, or you can come in and see us and we can help you with your rehabilitation after you've had it.